Hi, I'm Dr. Kivett in Santa Rosa, California. I'd like to speak today about wound healing with particular reference to nutrition, diabetes, and hyperbaric oxygen treatment. My board certifications include plastic surgery and dermatology and others. I also had a year of intense upper extremity surgery training with an orthopedic surgeon and a plastic surgeon whose practices were devoted solely to hand surgery, as well as doing several thousand cases during the plastic surgery residency on hands and other tissues. The discussion for today is that of wound healing, since it's a field that really has a great demand in the world, especially in the United States. And the wound healing we'd like to talk about today involves nutrition, the impact of diabetes, and the benefit of hyperbaric oxygen treatment. Wounds are simply defects in the integument that covers our body. The integument is simply the cover, the canvas, the skin that holds all of our organs in, that helps hold in all the fluids that permeate our body, and that tries to hold it in such a way so that everything works relatively well, almost like a well-oiled space capsule. If one part of the shell, meaning the skin, is damaged, then the whole world will suffer. And in fact, people with a certain amount of burns or a certain amount of skin lost for other reasons many times do not do well in life. Nutrition is important because our body is constantly turning over cells, both internally as well as externally. Externally, we're molting like snakes. So the skin that we have right now died almost 3 weeks ago. And this layer will go off in the shower tonight, and there'll be another layer tomorrow morning that has come from below. In addition, most of the cells in your body, you may have read, have turned over in the last 7 years, completely so. And so we're constantly processing proteins, sugars, carbohydrates, and fats, as well as installing all kinds of salts and other chemicals called trace elements into our body, and vitamins. Trace elements are those that are seen in the vitamin capsules where it mentions trace elements. And those chemicals help catalyze or help move certain cells from one position and one formation through a chain of steps to another cell that's a healthier one as the old one is shed and goes away. The trace elements are copper, molybdenum, vanadium, boron, iron, and other things. And so in today's world of non-organic foods, and in today's world of soils depleted, and in the world of genetically modified vegetables, a lot of times those chemicals don't get to us as much anymore. So between that, to heal the wound, between the trace elements, and the vitamins, especially vitamin C, protein, zinc, and iron, all of these are needed to help heal wounds in our body, both internal as well as external ones. Nitric oxide comes from L-arginine, which is one of the amino acids, and that's in low supply after injury. So that's another reason to have better nutrition. Stress will give increased levels of cortisol, and the cortisol is that chemical that's produced by the glands that are sitting above our renes, that is to say, above our kidneys, hence the name adrenal glands. And those glands are so important because they provide for us a number of chemicals, including epinephrine, which helps us run really fast if a lion walks in the door, and also cortisol, which helps us adapt to changing conditions of health. Obesity is certainly a problem for people, and that makes us more susceptible to disease. In order to assess protein and inflammation in the body, there's a number of studies that we can do. Of course, the most important thing is that we get the protein into our body in the first place. But TLC, that is to say, total lymphocyte counts of over 240, adequate levels of albumin, adequate levels of prealbumin, a chemical called transferrin, retinol binding protein. All of these have an increasingly sensitive measure of the ability of the body to have protein work for us. CRPs, or proteins that are helpful to us, can be measured, and so that's important to check out. The gut is very important. It is known, of course, as a food tube, but where the small intestine meets the large intestine is the cecum, and that's not a very big area, but it contains 100 trillion. That's an exact unit. That's just not guessing at a large number, but that's what the studies show, is 100 trillion germs, that is to say bacteria, funguses, and yeasts that are in the tissues of that area. And those are the seeds for the garden, and the garden soil is the food. So between the germs and the foods, we can either help our immune system or harm it greatly, and thereby make us more susceptible to infection, and in fact has impact on our heart. When people have diabetes, they are not alone. There are 84 million people in this country who have true diabetes. The same number, roughly, again, another 34% of this country also has a similar number of people who are in the process of becoming diabetics. Diabetes is not a fixed curse. It's not a fixed disease. It can be entered into and exited from by simple control of blood sugar. Not easy. It may not be as difficult as one might assume either. And it results in decreased wound healing, in peripheral arterial disease, in damage to the sense nerves that you feel when you touch a hot stove, or a loss of motor nerves when you're trying to move your fingers in a careful way, or autonomic nerves, which means you'll sweat inappropriately. There are also what's called neuropathies. That is to say, the nerves are inflamed and they can be itching. And so scratching comes from itching, itching goes to scratching. That both of those lead to infection, and both of those can lead to ulcerations in the skin. Part of the reason that diabetes is so undesirable is that because there's more sugar in the blood, there's more of a syrup that's a thickened, viscous material in the blood. And so literally the white blood cells, which are helping the immune system kill certain unwanted visitors, like a strep bacteria in your throat, a stitch that's still in the skin, some foreign body of some kind, a splinter, that really makes a difference. We measure blood sugars by fasting blood sugars to see what, in the course of a day, your blood sugar does. Also, there's something called an H1AC, which is sugar attached to hemoglobin, which is the main component of blood. And that's a 3-month measure of what your blood has done the prior 3 months. Treatments include eating fewer sugars, which is actually easier done than said, with its accompanying risk of hypoglycemia that has to be monitored if you're already a high sugar diabetic. Treatment also includes trying to reduce your insulin levels, all of these being described in a separate video on dietary impact. And other treatments, for example, the glucagon, which is the anti-insulin, mimicking glucagon drugs called Wegovy, Ozempic, and others. Hyperbaric oxygen is important in wound healing because you are in a clear plastic metal tank where slowly the oxygen concentration has been caused to rise higher and higher until such time as not only are your red blood cells, which carry oxygen normally, super saturated with oxygen, but then even your plasma, which is not used to carrying that much oxygen, becomes saturated as well. And so that particular modality of treatment highly improves your chances of healing wounds. So a lot to think about, but if you find that this is of value and you can recommend it to your friends, neighbors, and family, leave a comment or a question, give us a thumbs up, and if possible, subscribe so that we can continue to provide additional educational information to you. Thanks for listening.